This is Bruce Jancin with Elsevier Global Medical News at the San Antonio Breast Cancer Symposium, where I'm with Dr. Jessica Frisk, a general surgeon at University of Linköping in Sweden, who's just presented a study of 45 women with a history of breast cancer and hot flashes who were randomized to acupuncture or hormone therapy. Dr. Frisk, tell us what you found.
Well, it's really interesting because you know from before that the hot flashes can disappear with the hormone therapy, but with acupuncture we could actually decrease the number of flashes and stress by flashes with half, and that is after 12 weeks of acupuncture. And what we could see is that the effect actually lasts longer than we thought. It seems to last up to 9 months after the treatment has ended, which is a longer effect than a placebo, and it's also a stronger effect than placebo. And we don't think it's time that does this to the flushes, because some of these women have had hot flushes for 20 years, and then after 4 weeks of treatment the flushes has decreased to half number. So it's a decrease that is the same amount as for the SSRIs, like Effexor and those medications.
But without any of those side effects? Without
the side effects, yeah. It also has other effects that we didn't expect, like they sleep better, and in quality of life reforms we can see that the anxiety decreases, fatigue decreases, somatic symptoms like pain also decreases, which it doesn't do in the HT group as much. So what it does is it decreases the hot flushes, not to the same extent as the hormone therapy, but it does increase well-being to the same extent as hormone therapy, which is really interesting for these women who are seeking therapy.
And there are a lot of women seeking such therapy, yes?
Yeah, and it's increasing number of women as well, because now with all these new medications they tend to live longer, and with the treatment they actually have more flushes and more disturbing flushes than just healthy menopausal women. So there's an increasing need for alternative therapies for the hot flushes.
Do you have a concept of what the mechanism of benefit is?
We have ideas, and there are ideas and theories. We do know that acupuncture does increase the endorphins cerebrally, and it also increases serotonin in the brain, at least in animal studies. So we do think that the endorphins and the serotonin stabilize the thermoregulatory center, which is next to the hypothalamus, and in that way actually makes you less sensitive for the hot flushes. We do know that there are some vasodilating peptides, neuropeptides, certainly one that's called CGRP, that we do decrease at the same time as we give the acupuncture. So that seems to be a mediator of the hot flushes.
This is Bruce Jancin from the San Antonio Breast Cancer Symposium.